We all know this has been a long, difficult process. We have gone over most of the hurdles. It's like a steeplechase race. The last big puddle's in front of us. We'll jump over that and we'll be to the finish line. But really, it's been worth it. Tough race, but it's been worth it. The American people waited a long time, and you've heard us say that, for health care reform. Democrats aren't going to let the American people down. Be sure the bill, with the scope we have of it, their people have different opinions in the caucus, and that's, well, the way it should be. But we all stand shoulder to shoulder in the belief that health care reform is necessary and timely, and we're working hand in hand with the White House to accomplish that goal. I'm confident that by next week we'll be on our way to forward this bill to the President. And remember, this bill saves lives, saves money, and saves Medicare. We still await word from the now famous Congressional Budget Office to find out what they're going to do with the manager's amendment. But I'm confident that CBO, the conversations I've had with them, that provision, the amendment, will make our bill even stronger. We've been very careful in not talking about the specifics in the manager's package for reasons that are very, very obvious. We don't want this to be made public and then have to change things, so the CBO handles this just the right way. At the end of this process, Democrats, and we hope even a few Republicans, will be able to deliver good news to the American people, that we've passed a pro-consumer, pro-patient bill that stops health insurance companies from manipulating the system, makes health insurance more affordable and accessible, stops insurance company abuses in so many different ways they do that, reduces the deficit, reins in runaway health care costs, and strengthens Medicare for the future.
It's always easier to envision the legislation you want than to pass the legislation you need. And that certainly is true with health care. And whatever differences exist within the United States Senate, those differences will pale by comparison to the differences we can make for the American public with the passage of major health care reform. And I've been a part of this process very directly now for almost a year. And I will tell you this tonight, without going into the details, that before we leave here, in the next couple of weeks or less, we are going to pass national health care insurance reform for all Americans.
This will probably be our most important legislative effort for most of us who are now serving, and certainly since Social Security. This will mean, this legislation, so much for so many people. There are so many American people waiting for us. Are we going to act or are we not? Are we going to let them down or not? And we all, as Democrats, fervently feel that sense of urgency to be sure that we get this legislation passed. If you stop and think about it, it's just amazing. Sometimes people tend to forget the provisions that are in this legislation. Lower costs for Americans, higher quality of health insurance, increased health insurance, coverage for 30-some million Americans. Just think of that for a moment. Protection from harmful insurance industry practices, such as discrimination based on pre-existing condition. A bill that I said will lower health care spending, fully paid for, reduce the national debt, it will improve choice and competition in the insurance market, create incentives for better quality throughout our health care system, protect Americans from being denied insurance because of pre-existing conditions, from seeing their rates increase, provide tax credits. This bill lowers taxes for Americans. It's the biggest tax cut since the 2001 tax cut. On a net basis, this legislation, because of the tax credits, lowers taxes for Americans. I look forward to working with my colleagues. I am confident. I am, as sure as I'm standing here, I am very confident. I know that we're going to pass health care insurance for all Americans within a matter of a couple of weeks.